All right, cool. So how have you guys found have you tried some of that motor control stuff since last time?
Yeah.
Yeah.
Okay. And how have you found it?
Good.
Yeah, it's just a good additional tool.
Okay.
Rightly or wrongly, I've sort of used it as my typical things didn't work, so try that other stuff.
Okay.
And in those settings, it's probably been 60-40 effective. But yeah.
I'll take it. We'll
Yeah.
take it. Um, because it's quite a like TA multifidus bias in Queensland, right? Like they like you, yeah.
Yeah.
Mm.
You can palpate that, yeah.
Yeah, it's like it's hard because there's some of the earlier research, it's like 15, 16 years ago, they showed if you compare doing like core stabilization versus gym versus like motor control, which is what I'm going through, the patients kind of all get better.
Mm.
So I think it's just maybe on some patients you can subclassify them and then potentially get them better quicker. Yeah. Um, what was there anything else that you took away? Like what were the key subclassifications that you remember from last time?
Yeah, maybe I wasn't here. I think I'm thinking of the SRJ one. Was it the same one?
Lumbar motor control.
I know we did all we did all like stand things and like sit to stand. You were in like RDLs and stuff.
I was away. I didn't use it at all. Forget my 60.
You didn't make it stuff up.
That was the
All right. All right, that's cool. Do you want me to is there someone else off screen?
Yeah.
Both sides.
Two.
Oh, both. All right, come in a bit. Come in. There we go. Come in. Um, do you guys want to show Tim the testing? I can show you. I can demonstrate or get you guys to demonstrate it. But can you show me what you remember, Jez?
I remember absolutely nothing. I'm on paternity leave at the moment, so
So you're a bit cooked.
yeah, I'm on 12. I remember we did a lot of that sort of like leaning forward and then just lifting the bum up.
Yeah.
Um,
Okay. So
yeah.
basically, basically, right? I'll show you a couple of simple things. So the earliest research where they actually looked at testing motor control in like high quality trials, it's your main two are your sagittal direction. So basically the patients because a lot of it's going to be bending, right? Like the patients struggle to bend. And so they're either not lordotic enough through their hips, or they're too jacked up, like they're too extended. So the classifications that we would call them originally were a flexion pattern, which is where someone's too flexed and you need to create a lordosis with them. Okay. Or they're basically too lordotic or too hyperextended in their lumbar spine. Can you hear me?
Yeah, just telling us to buy antivirus stuff.
Oh, okay. And so basically, the best physios, I believe, you can assess the patient when they first come in, subclassify them in various positions, and then prescribe that for home, and then potentially progress them through like we in WA and in the master's course in WA when I was an academic, we would preference functional. Whereas a lot of like the Pilates training is to get the patients into pre-functional positions or like, teach them TA and multifidus in crook lying or in supine or in side lying, even 4-point. Whereas what we try to do is like find out what the patient can't do in the subjective, and we will ask them, what is the main thing you can't do? Typically it's bending or lifting, sometimes standing. then we'll assess that as a primary or priority in the physical. Then we'll try to change it.
Yeah.
It's like a TDT of sorts, but it's like it's like non-hands-on. It's just like getting them to do like different movements. So I'll show you. Has anyone got back pain now or not?
No.
No one? Ah, that sucks. All right. My wife says she does, but that doesn't really count. All right, actually we could use you, but I'm not gonna bother. Does anyone get pain lifting heavy? No? Okay. Tim, just stand up. Tilt the camera down a little bit. So hey mate,
I did.
how you going?
Yeah,
Actually sit down first, Tim. Just face side on. I'm just refreshing their memory. So face side on. Yeah.
like this.
Direction.
Yeah. But probably turn the chair around too.
Yeah.
So basically the assessments start, the motor control retraining assessment starts when the patients first come in. You've got to be like looking at their posture from the get-go. And it's like a binary, it's typically a binary thing. They either sit too flex, so slump, or they sit too bolt upright. Sit bolt upright. Really like extend hyperlordosis. Now, someone go behind him and like put pressure down through his shoulders. Just ram those down hard. So this is the test I do when they're sitting to see if it like reproduces pain in their back. It simulates the effect of gravity through the day, right? Now slump. Do the same. So you show them the exact opposite and see how it feels for them. So generally they'll fit into one of those two camps. They're too extended, they're too slumped, and you just give them the opposite. So with the ones that are like too slumped and they're better, so take yourself into a neutral lordosis. I'll show them that, give them exercises around that, which I think if we've got the video, you can go back and watch it. But I'll give them a lumbar support, like I did that with a patient this week. So I'll prescribe a lumbar support. Do you sell them off, Dave?
No, not usually. No.
I would say probably once a week I'd give one away. Yep. So I do find them useful, or you can get them to like roll up a towel and put it in the small of their back's the other option.
Okay.
Yeah. The other, we'll look at the video to revise, but if you stand up, the other main one I would see is bending. So bend forward, stop there. Let's say he gets pain like mid shins, right? Then you get him to come back up. They bend their knees a little bit. They then stick their hips out. So I would normally put my thumb on their sacrum. So if someone just stands up behind him and I show them, but I like push with my thumb like hard onto their sacrum. So they get the idea they have to stick their hip out. Bit more. That's it. So that's for the flexion pattern who are too flexed, or carry yourself right upright like that. Now lean forward. If they're like that, then you do the opposite. So bend your knees, fully slump, and then come forward. There's some patients who are better slumped. So that's what the restore, you can sit back down now, Tim. Thanks for your help. The restore trial, which was recently published, that Jay was a part of, if you've done sessions with Jay, they proved that if you can subclassify the patients like that, if you can put them into one of those two categories, they'll get better quicker than if you just use like a standard rehab program. So you probably should be on the lookout for, the first thing is that sagittal. Today I'll show you a few more types, And then I've got a case study, a video of a guy I assessed in South Australia when I did a course there. And I wouldn't mind showing you guys like the assessment. And then I'll get you to have like a brainstorm and see what you would give him. And then I'll show you what I gave him. And we'll see if we end up in the same place. Okay. He's tough. It's a tough case as well. So I'll put you under the mocker. So those are your first two, right? But I'll show you the next ones, which is what we said we'd go through. What's that? What's that? A dog?
No, a kingfisher hit the window.
Concussed itself.
Is it dead?
No.
Oh well.
It was a cat. Is it still there?
Yeah. Breathing.
We're running to the bed. See Brian's husband.
Do you need to go heal it, or you guys all right?
Snag.
Does it need to snag it? Need some physio? All right, I'll show you this the next. Just tell us that you can see this. So these are the next.
You can't see it.
You'll see it now.
It's okay. Done.
Can you see that now?
Yeah, we can.
He's standing. It's very short.
Okay.
Uh,
Okay, so you've got that flexion pattern, right? Where they're too slumped and you end up giving them. Do you remember this video from last time?
not sure.
Can you hear that?
No, we can't either. Can't hear it.
Oh, you can't hear it. Oh, that sucks. Can you see how he's progressing though?
Yeah.
Yeah.
Yeah. So this is a guy that had a flexion pattern, so we were getting him to stick his hips out.
He's got to get himself.
Now, the extension pattern was when they're too jacked up. There's another pattern that we tend to see, which is the extension pattern, okay? So these are what we call passive extensors. So what we might do, we'll assess everyone's posture in a second, but these are people, they're not so much aggravated in sitting, they're not so much aggravated in bending, they're aggravated when they stand prolonged, okay? Or if they do repeated movement, like gymnastics, cricket, sprinting, or if they walk for ages, their back gets sore, or if they run for ages, or if they're lying on their tummy and they find that gets really sore. Sometimes sit to stand, but not typically. It's more the like prone or upright positions. Okay. So when you want to ask them like, how long into it do you start to feel it? Is there anything you do to try and change it? That would be like some sort of cursory questioning that I'd ask when I'm doing the subjective. I'd also then have, these kind of good posture ideas are a little bit old school, but let's get, well, maybe all of us can have a practice of it. So Jez, can you just come stand up in front of the camera?
Wait for this moment.
Hey, shut up.
Wait for you, came down in a shirt.
Oh, good on. Yeah, you got you representing the Broncos there. Face this way. Can you pull your shirt up, show us your low back?
Yeah.
Just stand still, just side on. So if we have Jez there, and I share this image, which one do we reckon he is? You'll see it in a sec. Move back a bit. Move back a bit, Jez, from the camera.
Oh, me, sorry.
That way, like towards the wall.
I also can't see in the. That's not me.
So which one is he?
Good.
Is he good posture?
He's close.
It's not fun, man.
We'll give you good. We'll give you good. Okay. All right. You can pull your shirt down, mate. We don't want the Britney Spears look anymore. All right. Next person. I want you to come stand there, Dave. So pull your shirt up. Oh, okay.
What is that?
What do we reckon with Dave?
Bit more.
Yeah, a bit lordotic.
Bit more lordotic. Does everyone? So we can agree on that, right?
Yes.
Yeah.
Get rid of the Britney.
All good, Dave. Don't cry yourself to sleep tonight. All right. All right. Now, next person, come stand.
I'll do it.
There's no judgments here. All right.
You just.
Face side on. Pull your shirt up.
Take the camera out.
Just stand there.
I need to take my vest off.
No, that's cool.
I mean, you were a little bit.
What do you reckon?
You were slightly lordotic, and then you fixed it. Wait, let me just.
I reckon she's mildly lordotic, but she's not at Dave's level.
Yes.
That's what I'm saying. All right.
You live basically. That's what you do.
All right. Next.
DCS 13.
But I'm paying attention. No, that's not that.
Maybe mild thoracic kyphosis. Maybe. Not bad though. But she's probably
Lordotic.
a little bit lordotic, but not. So like these kind of descriptors I'll be putting in my notes. Like it's hard because there's not, there's always a degree of subjectivity to it. But if you look at studies, the physios are actually pretty good at typecasting patients into these certain postures. All right, next, Tim.
Get Kingfisher.
Okay, interesting. What do we reckon? I've got a fit.
Look up.
That's better. That's large as well.
I think he's a bit sway back. So I'd call him a bit sway back. So if you look where his shoulders are relative to like his hips,
Oh yeah.
do you see what I mean?
Yeah, a bit this way.
Mild. Yeah. So the sway backs are the more likely to get this extension pattern pain. Yeah. And last physio.
Hey.
The best was weird. Just looks weird for me.
What does everyone think?
So I was thinking.
It's pretty.
Yeah, you're just normal.
No, yeah.
Boring.
Normie.
You're pretty normal. You're pretty normal. Everyone else is abnormal. Okay. Now let's get you, Tim.
Yeah, I'm really upset. Like I want to put it in a box and take it to bed.
Are you guys actually upset about that bird?
Surface.
I am too.
Right.
All right. While you're here, lean back. Tell me if do you get any pain in standing at all, Tim, or not?
No.
Do any of you, like with prolonged standing?
No.
No.
Pretty restless. I mean, I think I naturally will tilt a fair bit. So if I stand and not think the whole day and I stand like this, then yeah.
Does it get sore?
Yeah, but not very sore.
Okay, come stand in the middle. Come stand in frame.
Yeah, that information.
Yeah, you've stitched yourself up a bit there. So now, just what I want you to do is, so you don't feel anything at rest now, though, right? Okay, lean back through your back. Tell me if you get any pain. Anything?
Not really.
Is it similar to what you get if you stand for ages not thinking?
Yeah.
Okay. Keep leaning back and just tell me if it gets worse. Like come back and then up and just keep repeating.
Straight there. You don't have to stop. Yeah.
As you keep doing it, how's it go?
Probably gets a little bit more uncomfortable. Like I feel
Okay.
like I want to stretch it the other way for a minute.
Yeah. All right. Now, everyone, so pull your shirt up if you don't mind, and then maybe just tuck your pants down a smidgen to where you feel the pain. And then can you come a little bit closer to the camera just so I can see?
I know, I did it.
So when she leans back, where does she bend from? What does everyone see?
I'll wait back.
Ooh,
Big like hinge. Like
yeah, like right on that zone, right? So it's like right on that kind of mid lumbar. That's what I'm seeing. Where do you feel it, Sophie?
That.
Yeah. Okay. So if I had a patient like this, I would then go in. So someone go behind, maybe one of the lads, go in behind and put a lot of pressure down through her shoulders. Hard. Do you do you feel that at all? Do you feel that at all, Sophie, when he does? Do you feel the same type of pain?
No.
So it's more when you lean back.
Yeah.
Okay. Do a few of the pressures, Dave. Like just do a repeating of them, like quite hard. Nothing?
I feel like pressure.
Yeah,
Like,
okay. Oh, we'll take it. So now tuck your bottom under, right under.
Oh, too.
And now do it again. Explain.
I mean, it didn't hurt the first time, but it doesn't feel like the same pressure and the same
Is it like change the spot?
Well, now it just doesn't. It just feels like more widespread. Just like someone's pressing on my shoulders.
But not as distinct, like in that
Yeah.
zone. Yeah, okay. Now tuck it under, right?
Mhm.
Keep it under and lean back as far as you can. What does her quality of movement look like when she does that?
I have to think really hard to do this.
Is it better? She can't move quite as far, but is the pain gone?
Doesn't look as hingy.
Doesn't look as hingy, right? So this would be for these types of patients, this would be what I'd be trying to like pick out, right? Now we can change that a little bit. So go just onto the left leg.
Just standing on my leg.
Yep. Lean back on one leg.
Can't balance, but
Maybe get a stick.
Chris. It's on the
Oh. Shame.
Weak it up.
How does it feel without the posterior tilt?
The same as when I did it on 2 feet.
Okay, do the other leg.
The same again.
Okay. All right. Now, go back to your first leg.
Mm-hmm.
Tuck your bottom under. Do the same. Is it difficult to do?
Yep.
Okay. Everyone have a go at that. So you can go hold on to the side of the wall. So like just practice. First of all, just lean back yourself. Just like, yeah, PS, you might be sore like this afternoon.
Yeah.
Everyone practice just leaning back on 2 feet. And then add in a posterior tilt and lean back. And then try practicing on one leg without the tilt and then add in the tilt, see if it feels any different. So I've used this for patients who have like unilateral pars fracture. Or just facet joint irritation one side. Or like a sacralized lumbar segment. Have you guys seen that before where the patients have got a transitional vertebrae? And it's like irritated. I want to isolate by doing ipsilateral. What do you guys feel when you do that?
I find it harder in the pelvic tucked under position, I guess.
Yeah. Yeah, it's
Feel
harder.
Lengthened and harder to slow me down as I'm up the front.
I felt like I didn't get as far, but it felt less jarring.
Yeah.
Yeah.
Like, it did feel a
It
bit
did feel
smoother. Yeah.
It feels smoother, eh? Yeah. Now we can kind of reverse engineer it as well. So come back up, Sophie. Sorry. Face side on.
Same as before.
Same again. Yeah. This time, is there one side of your back that tends to hurt more or not really?
No, I think it's pretty central.
Okay, cool. Just stand on your right leg and keep your left leg gun barrel straight and extend it. Like go into hip extension, like quite grossly on that side. You might need the stick again.
That.
Yep. Come back. And do repeated now. So if I don't get anything with lumbar extension, then I'll try and do unilateral, yeah, hip extension. How does this feel?
Actually, almost more so than the lumbar extension.
So that's actually good. So that's what we're looking for. Because sometimes you won't pick it up. You won't pick it up with lumbar. So you have to kind of fix their torso and then just isolate their hips. Switch the other leg.
Yeah, same on both.
Is it hard, eh?
That's not hard, it just hurts.
Hurts more. That's good. All right. Now tuck your bum under. Do the same.
Really extend.
You'll struggle to extend as far, but it shouldn't be as sore.
It's not.
Yeah.
I also just feel like I can't.
Yeah. You just can't get there. All right. Other leg. Okay. Now everyone go onto the wall. Like go stand on, against the wall. Maybe where I can see you. This back one. This back one. And try the same. You can have a bit of a break if you want, Sophie, if it's actually sore.
It's not that. Oh.
So do it.
Definitely less pressure on your back.
Does it take the pressure off?
Yeah.
Yeah, I can't go as far, but it definitely feels like it's not putting pressure all on one point.
Yep. Yeah, great. So that would be my next step, right? Then, if the patients can't quite catch that, have you got a bed there?
Yeah.
Yeah.
All right, wheel the bed in front, but crank it up quite high.
Oh, we need to, that's what we're.
Yeah,
No,
but
we
we can take the computer first. When you move to the single leg as opposed to just the extended positions, was
Yeah.
it to guide exercise or more to guide you to like pathology?
With this, right? Let's assume the patient hasn't had an MRI.
Mhm.
The reason I do this is A, to just give me an asterisk sign to reassess.
Yeah.
And B, to then my assessment will ultimately guide my progression of exercise, right?
Yeah.
Like if a patient, like Sophie's pretty good, but if a patient came in, like even Sophie, what she's got is she fits this classification like to a T. She's repeated extension brings it on. We take her out of the end range extension. Her pain's better. So I think it's like sometimes you have to test a bit harder, more aggressively to actually bring it on.
Yeah.
Because if we just did 1 rep and we just said, "Oh no, she's good," it would miss it, you know. But sometimes the patients don't like so sometimes the patients are unaware of how they're standing. Sometimes they don't know how to get out of the extreme position, like they've got no concept of where their posture should be.
Yeah.
And then sometimes they're just really, really fatigable. Like they just can only last like 5 or 6 reps. So in my head, I've got like, I'll do the first extension, then I'll do repeated. Then if they're too sore there, then I'll start to regress them to some of these other positions.
Yeah.
Yeah.
Okay.
So the other one you can do, so go move the bed kind of on a 45-degree angle if you can.
Which head?
The head, maybe the bot where Tim is like towards the wall. Yeah. Now go move it, push it away from the camera though. Yeah, cool. Come stand to the side there, Sophie. Like to the op. Yeah, no worries. Come stand there, and then face the wall. Face the wall. Pop your hands on the bed. So go into like modified plantar. Yeah, tuck your shirt up if you can. So go into like modified plantar. Like put your hands on the bed. Did you guys call it that?
No.
Oh, we call it modified plantar, which is basically like just leaning forward with your hands on a bed. You never heard that? Okay. So this would be another position if they're like too sore or they're too unstable. Now try in this position, just extend one leg back.
That's fine.
Okay, now do your left.
That's also fine.
Yeah, it's a bit easier, right? It's a bit more comfortable. Now tuck your butt under. Yeah. And then stand on one leg and just extend the opposite.
I feel like it's just hard to keep it there.
Do some reps though. Like just keep repping and just see how long you can last. The other thing you can do, right, is extend. So extend your hip and take it to its end position. Stay there. Now, tuck your tail, keep your leg in that position, tuck your tail under, and then let it extend back. And then keep tucking it under, extend back. So you keep your leg in the same. Yeah, you got it. Is that hard?
Yeah.
Yeah. Can everyone give that a go? So
I want to.
So practice both ways. Practice extending your hip repetitively in a tucked under position. And then extend your hip. Keep your hip extended and then practice tucking under and back. Is it hard?
Yeah.
Yes.
Have you guys done this stuff with patients before?
No.
Yeah. So this would be. It's like this helps you to work out. Does the patient have awareness of where their pelvis sits in space, or are they just super weak and fatigable? Okay. Any questions with that?
No.
Okay. Now, they're like, that's probably a much easier position to do it in when you take them into that hands on the plinth position. We can actually make it a bit harder. Okay. So the next one I would do, can you guys see this now? The next one I would do to isolate it a bit more specifically would be to go off the end of the bed. So we call that semi-prone, this one here.
Jeez, you guys are weird.
All right, now put the bed facing this way. So it's like
Parallel.
That way.
parallel, yeah. And move it this way a bit. Okay, get into that position on the end of the bed there. Sophie, if you can. Yeah. And then maybe someone sit on the top.
I really bend my leg.
Okay, now first thing, so just stand on one leg.
Stand is relative. My knee is very bent.
That's cool.
Okay.
Extend your hip up towards the ceiling.
It's working and I can't stand.
That's good. That's good. Perfect. Come back. Do some reps. Does it hurt your back?
No.
Do as many as you can do. It's like a terrible position, but all right, switch legs. Okay, now tuck your tail right under. Like do like an extreme posterior tilt.
Do that with her.
Harder.
Ow. When this hurts, it's just really hard.
It's difficult, eh?
Yeah.
Harder than the other ones.
I mean, I'm in like a half squat position, so yes.
It's like the worst ergonomics I've ever seen. But someone else give that a go. Maybe Jez.
Yeah.
All right. So laying down.
Yep.
And then kicking up.
Yeah, you got it. You got it.
That doesn't look as hard as when Sophie did it.
I think his leg's a bit back. His right leg's a bit further back.
Does it need to be under more?
No, this is actually pretty good. But now
Good job.
he's just more of an athlete. You know? So now tuck your bum right under. Yeah, and go. It's basically meant to it hopefully should take the pressure off your back.
Yeah, it does.
So you can you see how there's some patients who have like a natural inclination towards just isolating their back more because of their set posture. So this helps you to, I guess, determine if they're that person. Try your other leg. Now tuck your bum under. More glute.
Yeah, and like bit of abs.
Bit of abs. We're awakening the dormant abs.
Yeah, that's it.
All right. Someone go into prone. Someone just lie on the plinth or the bed. Yeah. Same deal.
Oh.
Where do you feel it?
Left lower back.
Interesting. Someone, maybe Jez,
Yes.
get your fingers like this, right? Like that.
Yep.
So get your one pinky on his lumbar multifidus, the two thumbs on his glutes, and the opposite pinky on his hammy. Lift, yeah, lift your yeah, that's good. So you feel that in your left back, do you there, Tim? How do you feel the firing? Like, what's the pattern, like the sequence of how they come on there?
Are you asking me or Tim?
You, Jess.
I feel it in the back first, and then hammy, then glute.
Yeah, perfect. Okay, great. Now, tuck your bum under. Now go. What do you feel, Jess?
Feels way more simultaneous.
Yeah. And
Well
what do you
done.
what do you feel? What do you feel, Tim?
Yeah, similar. I feel like my glutes are already engaged from the pelvic tilt.
You just remember.
All right. All right, girls, maybe switch up.
Oh. It's time to get up there. They're doing it down here too. You can see.
Oh, they're doing it down there.
That's normal. Yes. Oh, we can. Yeah. Don't really know how to live top. Are you feeling that way? Oh, I was clutching. That's all I could see. Before I felt like it was back. Right, how we glute. Yeah, yeah. Just feeling the glute when you do the other way. Top on me. I think I'm just using my fist to put the top under, yeah. Try. Still thinking, hang on. There we go. Yeah. It's a long glute there. That's really hard. Yeah, that's hard.
Hard, eh?
Yeah.
All right, now go into. Actually, let's use Tim. So Tim, go back up on the bed or onto your hands and knees though. Do the same thing. So do your left hip extension. Have it just real long lever though. Like don't yeah, and just lift it right up. Do you feel that in your back?
Yeah.
Okay. Tuck your bottom under. Lift your leg up now. Keep it tucked under and then lift. Does it take the pressure off your back? Keep it there and then lift your hip. Does it take the pressure off or not?
Yeah.
Okay, now shift your weight forward so your shoulders come forward. No, keep your hands where they are, but lean forward more. That's it. And now lift. Is it even better?
Yes.
Yeah. Can everyone have a go of that? Have a feel of that. So practice that position.
And then bring back and then top on that. And then tap on that, lean forward. And oh yeah, lean forward's good. Yeah.
What do you feel?
It made a big difference when I went forward.
It took the pressure off, right?
Yeah. I didn't feel it too much in my back to begin with.
You didn't?
Not really.
Okay.
I did. Sophie did though.
Did she?
Yeah.
Anyone else?
That's As a no.
No. Yeah.
Sure.
Okay. All right, Tim, now come lie on your back. Have you got weights there, like free weights?
Yeah.
What's the heaviest you got? Can we get a 30? Is that bed going to hold us if we put a 30 on there or not?
Yeah, sure.
Okay, have a line your back.
What am I doing?
Get the 30 and bring it. Get Tim to put it up on his hips.
I'm scared. Put it where? Where am I putting it?
Can I do this lying flat on the floor?
Yeah, flat on the floor is probably better.
So maybe that.
Just have to deadlift it now.
What am I doing?
Get the weight and just give it to him. And Tim, you hold it on your pelvis at the front.
On my shoulders.
No, on your pelvis. Like just like between the ASISs.
Okay.
Come on, mate. All right, now bend your right knee up first to 90. Lift your the other right. Put your right foot down. But bend the right knee up to 90 degrees with your foot flat on the ground. There we are. Lift your left leg up in the air, just a little bit. Yeah. And lift up and hold it. Now lift your bum up.
Maybe.
Bridge.
Mid-bridge.
Yeah, bridge up. Go back down. Do some repetitions.
Okay.
30 kilos is crazy.
Am I like testing the friendship here?
Yeah.
Do the left one.
It's hamstring, all hamstring.
Is that all hammy?
That
What-
was it.
Is that more hammy?
Yeah.
Okay, go back to the right. Tuck your bum right under. Where's that?
That's easier.
Easier?
I feel like
Look.
it's still hamstring, but I've got more help.
Yeah. Sure. Other side.
Yeah, that's a lot easier.
Yeah. No, any pressure on the back or not?
No.
Okay, cool. All right, everyone else give that a go. Maybe not with the 30, but
Go
What's she say?
a few eights.
No,
Okay.
at least 20. Bottom rack only.
What am I getting? My head is. So much. I don't think I just this the other day.
At least.
So.
That's yeah.
I bent forward so one, what are we doing? And one, like up, and then bridge. I just.
And then with it, tuck all the way under.
Yeah.
4 hamstrings.
I was impressive of this. And then tuck. Well, it's supposed to be the other side, actually. That's always my left waist feel a little bit right. Wait, are our knees supposed to stay together or like just off the bed? Let's just look around.
what do you feel, Jez, when you're doing it? Is it a massive difference in like the recruitment?
Yeah, it feels easier, but obviously the more reps you do, the harder it gets. So
Yeah.
yeah, it is easy with the tuck.
All right. Now let's move the plinth out of the way. Let's go next level. So bring the bench into the middle. Bring it forward. We'll use you first, Sophie.
What was that, sorry?
We'll use Sophie first. So just put the, as long as your back's okay.
Yeah, that's fine.
Go into that semi-prone position where you sort of like most of your, basically up to where your glutes are is on the bed, but your legs are off. Do you know what I mean? So come to the end where you are. Yep. Yeah. We got it. Yeah. And just rest your head down. Okay. Turn towards me. Put your hands up on the, yeah. Now, what I want you to do, this might be just ridiculous, but I want you to lift both your knees and feet up in the air. Like see if you can do it. You might want to move your whole self onto the bench more.
Oh,
You got it. Nice. Do some reps and tell me if you feel it in your back.
how far am I supposed to lift
As far as you feel comfortable.
it?
Go shorter lever, like bend your knees a bit more.
So just
Yeah.
that.
Yeah, just that. Yeah.
Oh, it's cool. Jeez.
Hammies.
Yeah.
Again, tuck your bum under. Tell me what you feel.
I don't know.
Try just one leg.
I don't know.
Have one leg down. Yeah.
I don't think I can hold it tucked. Is my problem.
Yeah. So just keep it tucked and only go as far as you can maintain that tuck.
I mean, it's definitely easier with the top.
Yeah.
Not that I'm doing a very good job.
All right. Let's switch up with Tim.
What am I doing? Just hip extension.
Yep. Just do right side first. Anything in your back?
Just pressure.
Left one? You don't seem to go as comfortable on that side.
Yeah. Harder.
Okay, now tuck your bum under.
Hell, there's a plinth in the waist. Still hard.
Okay, now get your whole self up onto the bench more. Come a little bit towards the end, like shimmy that way a little bit. Yeah, stay there. And try and do both legs. Does it hurt your back?
Not hurt, but yeah, there's a lot of pressure.
Okay, tuck your bum under. Keep it tucked under. Only go as far as you feel comfortable. Tough?
Yeah, tough, but not the pressure on my back.
Yeah, cool. All right. The others can give it a bit of a go. Just see how you feel. Have you guys ever done this stuff with patients?
No.
In 4-point, but not this position, yeah.
I already did it. Yeah. Am I good? No.
Yeah, that looks good. Yeah, good. Geez, you look strong.
I am feeling that hips more in my back. Oh.
Okay, now do the tuck aggressive, like really tuck it under. Hard.
Can't keep it on. Yeah.
Put more of your weight onto the bed, the bench.
It's hard to talk though with the bench.
It is a bit harder. You won't be able to go as far.
Yeah, it's not on my back, but I've got like no range.
Yeah. Okay. So when would you guys use this stuff for a patient? So summarizing. So with what we've just gone through, how would you interpret that? Like how are we going to use that?
Tension-based lower back pain and standing when they've got poor muscle recruitment of certain things.
Yeah. And then how are you gonna like give me a list of like 6 progressions.
There's the repeated extensions.
Yep.
Just eating.
Yep.
And then the tilt.
Yep.
There was standing and kicking one leg. Oh yeah, doing one leg.
Yep. Yep.
Yeah, kicking one leg back straight.
Yes.
Doing planar, whatever it's called.
The forward Hands on the
half
pad.
half planter or something.
Yep.
What's it called?
Semi-prone.
No, the one
other
before that.
Oh, modified plantar grade.
Modified plantar grade. Yeah, semi-prone.
Single leg glute
Four
push.
strategy one.
Yeah, cleavage.
Yep.
And then just the double legs over the edge.
Yeah, which is like pretty much the boss level. Yeah. So with some of the like, so I would be thinking like runners, gymnasts, dancers. And I'd always try to think, what are they like in their extreme lordosis? What's their awareness of how to correct? And also what's their endurance like? Like, can they actually maintain the tucked under position? Standing is probably where you'd start, but ultimately you want to try and take them to these more extreme positions to load up the glutes. Does that make sense?
Yeah.
Okay.
Is the modified plantar grade the easiest position?
It's that's probably the easiest, yeah.
Easier than the standing ones?
Because because your hands like do a lot, like take all the weight off.
That's a regression versus the others that get harder.
Yep. Yeah. Yeah. So, but the most important thing is subclassifying them first. So I'm going to try and show you this case. I'll just see if it works. Hopefully it works. I've got this really cool case I want to show you. If it doesn't work, I can get you guys to load it on your computer and then you can share your screen with me. But let's try this first, right? Can you see this?
Yeah.
Yes.
Okay. So tell me, please, that you can. Can you hear that when that starts playing?
No.
Oh, bugger. If I take this out, can you hear me now?
Yeah.
Yeah.
If I play this, tell me that you can hear it.
No.
No.
And you definitely can't hear it now.
No.
All right, what I'm going to do, we'll take 5 minutes, but I'll send you, Tim, I'll send you a link to this course.
Sure.
Then if you can log into it and share your screen so I can, so we can still keep the Zoom video going, and then we'll watch it, and then it'll be a good like brainstorming exercise for some of the ones I've showed you last time and this time.
Sounds good.
Sound cool? So you can have like a couple of minute break, maybe 3 or 4 minute break, and then I'll send you this link. Okay.
Sounds good.
Cool.
We can.
View this patient. We'll do a bit more lecture at the end, but I've got a short form orator that he's completed that you can look at. You can look at the individual domains, and I'm looking at them quickly, and I've got some ideas already just from what I've seen. And then as I'm going through the subjective, what I've found to be very helpful when I was being mentored and when I was going through this process is write down maybe some of the phrases that I use, maybe some of the points of connection, like where am I starting my subjective, where do I go to, postures I might use, am I connecting, see how it goes. Then I'll try and use some of this motor control / cognitive behavioral / CFT approach. And I'll see if it's applicable. Hopefully it is. And then it can be, I'll try and come up with a treatment plan, or I might give them an intro treatment plan and then see what you guys think. I might even give a bit of time for questions as we're going through as well. Subjective, physical, assessment. So we'll try and use that same thing you saw in that 2018 article. Hopefully we can use a part of pain re-education, behavioral experiments, and then lifestyle. We'll see how much it suits. And then, actually, remember how I said all those different domains that we've got? Like in that 2018 article, they have like pathoanatomical, pain sensitivity, social, lifestyle. We'll try and think, where does he fit on the mix? That translation framework. We'll try and see, is he high on one? Do you remember that little grid thing that you saw in the article? Try and fill that out for him. And you can pass Aaron and have a look at it. And then we'll bring him in. Okay. So exactly like I did in the video, what I want you guys to do is get a pen and paper, okay, and take some notes as I'm going through. So I'll do a subjective now, right? And I want you guys to, based on the subjective at the end, tell me what you think his classification is. Okay?
That's good.
So we'll play case study part 1. Give it up for Mark.
Just waiting for office supplies to return.
It's cool. So yeah, my name's Garrett. I work as a specialist physio, and I do actually second opinions most days of the week. I do reviews locally from Perth. I'm actually from New Zealand, which is a superior country to Australia. And often what I'm trying to do is to see how much physio can help. Is physio even appropriate? If it is, what are we meant to do? And today we're going through like a lumbar spine workshop. So it can be really useful to see if what we've taught today is even going to be applicable. And often it is, but sometimes it's not. So from your point of view, what would you most want out of a second opinion consultation like this?
Probably long-term pain-free, on the back. Like, what did you find of that physio? The pain's relieved for probably a week, then it just keeps coming back, and try to get more relief over a longer period of time, sort of thing, and maybe if I could be pain-free for a month, great.
Okay. So can you tell me your story?
Right. Oh, geez.
Let's keep it to a minute and a half, maybe.
So with my
With your back, yeah.
So I was a furniture polisher for nearly 30 years. So lifting furniture all day. On my knees, standing up, bending forward. And the bending forward, what really got me with the pain. Even now, I do frames for a living. I look up the fish tanks. Just standing, leaning over a fish tank for an hour, it just kills me. And I'll stop for a few days back pain.
Really?
So leaning forward is what really loads up my back and creates a lot of issues. But I've got a few bulges there. I ended up last 7 years of my work was put on dental patches.
Seriously?
100 milligram plus endone for 7 years.
Be off that now.
I'm on trying off slow release.
Does it help?
Not anymore, but I'm finding it hard to come off it.
Yeah. Yeah.
But my tolerance to pain medication doesn't work anymore because I've been on it so long and so strong. What I found was after coming off the patches, my sense of to feel hot and cold is diminished.
Is it?
So it could be a freezing cold day, I wouldn't feel cold.
Really?
Because my nerve endings, I guess, were damaged by the fentanyl.
Where is the pain? Can you show me and point to it?
Lower back.
Maybe have a stand up chest. Maybe turn it this way.
This way.
Yeah. So there. Yeah. Okay. Right, does it go anywhere else or?
I do have signs of pain in my right leg.
Yeah.
So it was several months now.
Okay. Does it go all the way down your leg?
Yes, it does.
So where?
Bottom of my feet. I do get burning on the bottom of my feet.
Both of them or just the right?
Very stiff.
Yeah.
But when I use the spiky ball in Pilates,
Yeah.
I can tell. It's really like really bad.
Bottom of the foot.
Yeah, and I'm really tight in my legs, my calf muscles and hamstrings.
Through here.
Yeah, like really.
On both.
Yeah.
Okay.
I
But is back the predominant issue?
Yeah.
Okay.
Back and I do have a like bulge up here, which sometimes moves out in and out.
Does it?
I just get a crack back in.
Okay.
That's a regular thing.
Yeah.
Neck is usually bad.
Yeah.
At the moment, it's pretty bad.
Is it?
Mm.
All right. Have a seat. So when did it start getting real bad?
Bad?
Yeah.
Oh, probably 15 years. Well, actually, no, hang on, let me just see. Well, what started it, right? I reversed the trailer and the jackknife in my driveway. 6x4 trailer.
Jesus.
I picked up the back of the trailer.
Oh yeah. Wow. Okay.
I just do weights.
Fair enough.
Just struggled like this on the feet,
Yeah.
sideways.
Yeah.
Put it down. Some weeks later, that was it.
Severe.
Yeah, severe. And I kept working because I couldn't just give up my work. So it's been ongoing treatment, painkillers, and physio, specialist.
7 years. 15 years. Wasn't it?
Yeah,
And then, do you think it's got better at all?
yeah. Since I stopped my previous employment to doing furniture, it's
Disease.
But when I started 5 years off work, I did my income protection right with full pay. That was fine. I reckon it took probably 2 years before the pain subsided.
Yeah. Wow. Is that a typical pattern you'll do? Like if it flares up, will you just take time off, or
No.
now just push through?
What I did do was, I couldn't sit more than 20 minutes in a chair ever.
Really?
Couldn't go to the movies. No,
Yeah.
the pain was too bad. I ended up having prolotherapy.
The health.
Yeah, it did.
Okay. So overall, right? If 0 is the absolute worst it was, 100% fully fixed. Where would you put your back on that spectrum now?
Nobody had fully fixed. It's just pain management, really.
50%, 60%.
Probably 50 or 60.
What can't you do that you'd like to be able to do?
Jog.
Jog. What about more day to day though? So is that jogging like a long term thing?
Yeah, my hip is like, I don't know, very stiff.
Is it on the one side?
Maybe both.
Maybe both.
I sort of look like a bit of a robot. I'm not fluid through my
What about
pelvis and
you said bending? Like bending over.
stooping forward.
Is that the worst?
Yeah.
Without question.
Yeah.
Okay. After how long? You said an hour, but is it sometimes less?
Oh yeah, I can't stoop forward in the same position more than a few minutes.
Really?
No.
In there.
Low back.
To go down here as well. If you do that, or mainly there.
No. Back.
And then what do you do when it bothers you in that position?
Straighten up, sort of lean backwards a bit. So I use lumbar support pillow in the car.
Does that help
Does.
significantly?
Yeah. Does.
Okay.
I couldn't be without it.
Really?
No.
The 20-minute thing, does sitting bother you now?
It just burns.
Does it
It's constantly burning.
get worse than that?
It does, yeah.
More than 20, like an hour, 2 hours?
Yeah, after an hour in the car, I'm like
Pretty bad.
struggling a bit, yeah.
Is there anything you're avoiding? Because you know if you do that, it's going to piss you back off.
Well, at home, typically, I won't sit on the couch and watch TV because it's prolonged sitting.
Really? And because it's worse because it's deeper?
So I prefer to lay on the couch, lay on my bed,
Your tummy back?
my back.
Yeah.
But I can't sit long term on the lounge and watch TV.
What about picking up heavy stuff? Can't.
I can manage 10 kilos without having too much pain. 20 kilos can't. It just, if I lift up a 20 kilo bucket,
Yeah.
walk down there,
Yeah.
drop it,
Yeah.
I'll be in pain all day.
Really?
Mm.
Okay. Have you had scans?
Yeah.
You mentioned it before.
I've had millions of scans.
What do they show?
Disc bulges, compression of the discs, so the spacing is minimal. My flexibility is reduced, like just bending down, doing up my shoelaces is tough.
That's tough.
Mhm.
With respect to the scans, what's your interpretation of that? Like, what does that mean to you?
Well, I said I've got the back of an old lady,
Really?
Yeah.
Who said that?
the specialist.
How did that make you feel?
Oh, pretty bad, I guess.
Really?
Mm.
Pissed off? Frustrated? Like,
Well, they wanted me to go on a disability pension. They said your days of, being any sort of physical work, that's gone. They said you could probably get go into a disability pension because your back is that bad.
how'd you take to that?
Oh, I didn't like it. So anyway, I changed careers, took time off work, and a lot of physio and
To build yourself back up?
Hmm.
Do you believe your back can get better?
no, not mentally.
Ever?
I've been told too many times it's stuff I don't believe it. Well, maybe.
What would convince you that your back could get better?
Well, at the moment, I'm losing a bit of weight.
Yeah.
To get the weight off, and 6 kilos in 6 weeks.
Nice.
And I find now I can actually
COVID kilos. I'll put on 12.
Has it?
Pull the ripcord.
I'm actually doing it by taking a tablet, but
Okay.
I'm finding I can actually walk
Yeah, really?
at a regular pace,
Okay.
not a slow pace.
Yeah.
Because I have pain in my legs,
Do you?
hamstring.
When you are in that position where you feel the pain, what are you thinking about your back?
I don't know, I'm just thinking I'm not old man.
How old are you?
58.
Oh yeah, it's not that old, really. Do you would you say you trust your back?
I trust it now.
Fearful of using it?
Yeah.
Okay.
I
Is there,
say
there are things that other than that bending thing that you're mindful to not do? You said the couch, you said the bending, you said the lifting. What else we got?
I always make the same mistakes. I pick up something too heavy, and then I'd pay the price for about 4 to 6 weeks and agony.
4 to 6 weeks.
Yeah, for the pain to get reduced.
What else does the specialist say or do?
They
Specialist.
said to do swimming
Okay.
and cycling, or go for walks. That's what you can do. They said there's no treatment they can offer me. Pain management. So my GP put me on fentanyl patches,
Yeah, and then we've
which I come off because one of the specialists said it's going to kill me. And nearly did. It's a bad thing to have long term.
so other than the tramadol, you on any other meds and the weight loss meds?
Just with blood pressure.
What and you
Oh, and so also I'm on Duromine at the moment just to lose a few kilos.
what exercise do you do from the physio and maybe just physical activity?
I walk 20 to 30 minutes a day.
Awesome.
I'd like to be able to walk more, but I can't because of the pain.
In the back.
Yeah.
Yeah. Okay. Yeah. How much would you like to be able to do?
Oh, an hour.
Really?
Mm.
All right. What exercises the physio's giving you?
We'll do Pilates once a week.
Yeah.
At Campbelltown.
Campbelltown.
which I find great. If I'm just a session of Pilates, I just find a lot stiffer through the body.
It loosens it up.
Mm.
How long does that last?
About a week.
Does it? And did you get physio as well? They do work on it.
I see Tim every 2 weeks as regular maintenance.
What does he do?
What I tell him, what I tell him I want done, and he knows.
What stuff? What stuff's that?
Do usually a mid-thoracic knit.
Yeah.
Some erector spinal release stuff, like therapy. So we've done stuff in like the flexion, bottom back under heels.
Yes. Yeah.
Sometimes rotations.
Yes. Yeah.
Sometimes PAs if in my work.
Low lumbar.
Pretty much low to mid thoracic.
Yeah.
And then low lumbar PAs often.
Yeah.
But then also rotations.
Yeah. Good. How's your sleep?
At the moment, a bit iffy because of my tablets I'm taking, but I used to actually get really, really bad muscle cramps in my legs.
Yeah.
Through here, and like I'll be in agony, can't walk or anything.
Not so bad now.
Not so bad now.
How many hours sleep do you get a night?
Because of my ongoing pain and that, I go to bed early,
What time?
probably 8:30,
Time do you wake?
probably 7:30.
Not bad. Pretty decent. But how much of that are you sleeping? Yeah.
So I probably sleep 8 to 10 hours.
But how much do you wake feeling rested?
Not really, because
Do you wake through the night?
yeah,
How frequently?
3
How long does it take to go back to sleep?
an hour.
Yeah. So it's quite broken. So your sleep's pretty crappy.
Yeah, so if I don't go to bed early, I get enough sleep.
Yeah.
So I'm always having a break of sleep.
Yeah. And it's your back that you feel.
Yeah, so what I do is I'll lay on the side,
Yeah.
I'll lay on the stomach,
Yeah.
then I'll lay on the back for a while.
Yeah. Do you feel like how long do you think, if this can get better, how long do you think it's going to take?
Bit of a loaded question.
It's a tough one.
mm.
Maybe it's hard to know.
From what the specialist told me, I just said we can't fix your back.
Yeah.
There's like other treatment sectors, maintenance, physio, a bit of exercise, and
Is it like, in terms of the context of your life, how much does your back get you down?
a lot.
Significantly?
Hmm.
Depressed?
Yeah.
You spoken to anyone about it, or
No,
anxious?
little bit. I'm generally quite a relaxed person,
Yeah, you seem it.
but I do get a bit anxious sometimes if I can't do my job.
And then just lastly, about that job. So what is it? What's the job? It's you're cleaning tanks.
The creative maintenance.
So like, how does a typical day look for you? Like, what do you do? So you'd obviously drive to work at that around town.
I'll do 3 to 4 jobs a day, so I'll go to do a service. I'll take water out, clean the filters, clean the glass, trim the plants. So what involve bending into the tank.
Yeah.
As an example, I set up a tank a few weeks ago. It was a fully planted tank, 4 foot. It took me 4 hours. I'm still shopping for it now. I'm still in pain from that. Now it's, for 3 weeks ago now. Yeah.
So on a typical day, how much would you bend? How many hours?
Probably at least 3.
Yeah.
Just not a lot, but just enough to light up my lower back, and then you get back into the car.
Yeah.
And it's sitting
Yeah.
out of the car, leaning again.
Yeah.
Um,
You trust your legs?
my legs always feel sore, weak, burning.
Do they?
Not like straight for my legs.
Front and back? All over?
Mainly
through there.
Yeah,
Yeah, okay.
I really still.
All right. Is there any other questions you want answered from me?
So I believe you have some new techniques to treat
Yeah.
pain.
Yeah. So there is. Well, I'm going to go through it now. And already in my head, there's lots we can test and lots we may be able to do for you, which could be pretty powerful. There is clinical trials that show with people, and we can give you videos and resources to watch with long-term back pain that can actually get significantly better, like considerably, if we take it the right way. It's a bit of a change in how we do it, and it's kind of getting you to move differently when you're not at physio. So we have to sort of draw that brain-body connection, how you think about your back. And I'll try and prove it, and we'll see if it works. My friend and his team in Perth, of who I'm mates with, they're like research professors, and they've done multiple clinical trials that prove it works. And so we'll see if it works. And I'll be honest with you, if I think it can. My gut feeling is there's definitely stuff we can do.
I feel really stiff through my pelvis and that.
Yeah.
Then when I walk, I sort of it's
I feel like you're bracing it, like
yeah.
Yeah.
Oh yeah. I can't just like move fluid like I used to. It's like sort of like holding my, I don't know how to explain it, but like guarding my midsection, I guess.
Makes sense. Yeah, because you do sit quite erect.
I have to.
What
Otherwise,
if you slump?
oh, it just lays on my back and it just starts.
Does that hurt more?
Yeah.
Okay.
I'll sit up.
Does sitting up's been better?
Yeah.
Okay, cool. Might be worth getting a towel. Someone's got a towel. And then we'll go through some different things. So in summary, has anyone else got anything else to ask? Probably heaps to ask, but that's a general view. So in summary, Mark, bloody had it there for a while. That 15 years ago, was it, the trailer thing?
No, I don't think how long ago that was.
Seven. Maybe I heard wrong. Some time ago.
Probably 20 years.
20 years ago. 20 years ago, that back incident was sore, so much so that you had to take the time off work.
No, I still worked, but I'd come home and lay in the bed and be in tears.
And then you've seen specialists, you've been on the medication, has got better to an extent, but you're still clearly bothered day to day by it. And it's, there's things you can't do that you'd like to be able to do. Some people have written you off, still getting great physio, which has been effective, but we want to see if there's anything else that we could try.
But you know what, all these specialists and chiros, my back was really bad for a long time, right?
Yeah.
We feel this bulge in my back, and then it's what Tim, he goes, oh, your back's out, and you pushed it and cracked it. Pain went straight away.
Significant.
I've been on really strong painkillers for 3 years to control that pain in my back.
Yeah. That's very good. All right, should have a look.
Yeah.
Stand up, man.
So I don't take my top off.
Actually, if you don't mind.
Like 6 on.
Yeah, all right.
Okay. All right. So maybe just stop screen sharing for a sec there, Tim. All right. What do you guys reckon? Easy case, moderate case, tough case.
Tough case.
What's his dominant problem?
Flexion.
Flexion. If you were to have a guess, what do you think his motor control pattern is going to be?
Prolonged bending forward, prolonged sitting. I would say flexion.
Flexion? Do you reckon he's too flexed or too stiff?
From some of you questioning, too stiff, but from those aggravating factors alone, too flexed.
Yeah. Okay. So what do you reckon of the information he's been given so far by the specialists, quote unquote? the surgeons.
Cooking.
Hey,
It's cooking.
it's cooked him. This guy's absolutely psychologically noceboed. So what do you think his interpretation of what's wrong with his back is? Do you think it's accurate?
No.
No.
Do you think there's stuff we could try?
Yeah.
Okay. Should we have a look at the physical? We're probably going to run out a bit of time, but we'll start it maybe the next 10 minutes.
From his aggravating factors alone, I would have led more to a flexion control impairment.
Yeah.
Is there anything else that he said that led you to think about an extension?
Honestly, in second opinion, you're just thinking, no, I think it's flexion. I think it's flexion that's the problem. But it's what he's doing when he flexes. That's what I'm going to be looking at now.
So I couldn't really hear as well. I don't know if I got asked in that hearing, but what was his like current home exercises and things like that?
He wasn't really doing much, eh? He was basically just like attending Pilates
Yeah.
once a week, and then he was going for like maintenance treatments.
Right. Because even as well, when they talk about, his advice of just swim, cycle, or walk, I'm like, look, if he's too sore to sit down for a TV, then cycling is probably not going to be.
That's a bit of a token thing I find from the neurosurgeons.
Yeah, right.
I don't know if you guys have heard that. They'll often say that.
Yeah.
They just kind of give the patients this kind of like token, try this sort of.
Yeah. I don't know. I just thought, if I was someone that's like, I can't sit down for more than a couple of minutes, and someone's like, you need to ride your bike more.
Oh, dude, welcome to my world.
Walking is good, and maybe that's somebody else. Like, okay, that's maybe don't do that if it's an aggravating thing.
Yeah. Oh, these people get absolutely noceboed. Like, it's by the time they often get to me, the damage is done. But yeah. All right, let's play it. See what happens.
Side on. Now, so do you have pain right now?
Yeah, but like back. Yeah.
In that zone?
Yeah.
When it was here, what would you say it was like out of 10? 0 being nothing. 10 being-
Probably about 4.
Yeah.
It's a steady
And here?
Bit less than standing up now.
Standing up to the belt. Yeah. Okay. So if you just lean backwards gently.
What hurts?
Does that hurt? Does it?
Yeah.
Okay, relax a bit.
I got to stoop forward to feel comfortable.
So when you stoop forward, it's better.
Yeah. So when I walk, I tend to walk like this a bit instead of bending back a bit. I stoop forward.
So if I do this, do you feel that in your back?
No.
But if you lean back a bit,
Oh yeah.
and if I do that, is it worse?
Yes, it is.
Okay. But if you go forward onto your toes more, like drift, how does that feel?
Now it's starting to hurt.
Does it? Okay.
But there's a sweet spot there.
Is there? Slide your hands down the front of your thighs. Where is that? Point to it. Through there.
Yeah.
Okay, come back up. Okay. Bend your knees from that. Bend it. So keep your heels down.
Like this.
Yeah. Now lean forward. Does it still hurt? Or is it easier?
Easier.
Really?
Yeah.
Does when?
It's like pain at all. It's only pain in my legs.
Keep going. Come back up. That was pretty insane. That was a very good improvement.
Ooh.
Bend your knees. What I want you to do, look at me, right? So when you went like that, you could hardly move. When you bent your knees, you take a lot more of the load off your back, actually, onto your legs.
Yeah.
So it allows you to move more normal. So can you do a similar sort of thing? Bend your knees.
Yeah.
Fully relax your back. Lean forward as you do. Breathe in through your nose. Let your tummy go. Let it relax. Pause.
I can't. I'm guarding it.
You are guarding it. Yeah. Let it chill. Lean forward though, and breathe out. Lean forward as you did. Relax your hands. You were good before.
Yeah, like this. Yeah.
Now bend your knees. Bend them. Bend your knees more. How's that feel?
No pain there.
Wow. Okay. Keep going. Keep going.
Don't need lower.
What stops you there? Legs. All right. Oh. When you come back up,
It burns so much.
what?
My legs.
Well, it's better than your back.
Oh yeah.
All right. Do a few of those for me. Do some reps. Bend your knees.
Yeah.
And I want you to go down, touch your toes, and come back up. Brilliant, brilliant.
I can touch my toes. Wow.
Bend your knees.
Yep.
Breathe in, breathe out. Keep going. Relax a bit. How's that feel to do that?
No pain with that.
Keep going, mate. Amazing. All right, keep going.
What's
When
that?
was the last time you did that?
Never.
Really? Bend your knees, relax fully. So what you're doing a bit, right, which is hard to do, that's a bit hard in front of the crowd. Guys are kind of used to it, and I can do it a bit now because I've got a COVID orthopedic pouch. Kangaroo. Hey? I've got COVID in WA, but I mean, Uber Eats, that's the worst thing, yeah. So bend your knees, let your tummy go out. No core. Let it go out. Breathe out through your tummy. No, don't tense it. Let this all relax fully.
I find it hard and it's a psychological thing.
Yeah. You know, have you heard this analogy? If I was going to punch you, what would you do?
Tense.
Okay. Imagine your wrist, your back. Bring your wrist up. Tense as hard as your body can. Real hard. Now move it for me. Hard and back. Now relax it. Move it. Which is better?
Relax.
Yeah. Let your tummy go. Bend your knees. Fully relax your back. Breathe in through your nose. In through your nose. Out through your mouth. Lean forward. Let all this relax. Bend your knees, man. I want you to touch those toes again. Keep breathing. And come back up. Fantastic. Do it again. Keep breathing. Don't hold your breath. Great. Keep going. Relax your arms more. Hang them almost like a gorilla by his arms by sides. Yeah. How are your legs feeling?
It's sore.
Terrible.
No, just
Sit down in the chair. Stand up. Sit down. Stand up.
Yeah.
Flex your hands both sides. Sit down. Don't use your hands at all. Lean forward, all the way, all the way, all the way, all the way, all the way. Head down. Breathe in through your nose. Breathe out through your mouth and stand up. Not bad. You feel like you're gripping a bit to do it?
yeah. I tense my
Don't tense your core. Have you been told to do that?
no, but
It's intuitive.
it goes against my back pain, I guess.
What if I was to tell you that there's no studies that show that that helps? In fact, of this research, these researchers in Perth, and we'll send you a video which confirms it. And they've got people exactly like you, and they follow them up in a year, and they're significantly better. We stop them from guarding and bracing and getting them to trust their back, and it's
How would you do that unless you, I don't know, take a tablet to make you really relax, like Valium, or
you could. What if you can override it? You can override it by practicing it.
just by repetition?
Hundreds of reps.
Yeah.
Sit down, no hands. Stand up, no hands. Okay, you hear how you went?
Yeah.
Don't do that.
So when I go to sit up, stand up, I'll hold my breath.
I would stop doing that. Absolutely. Yeah.
It's just
I think it's intuitive. It's a thing you've learnt to do, and you don't know you're doing it.
Mm.
But it's good to be aware of it, so you can unlearn it. And so what you do is you lean forward. And then you go. Going. Relax your hands by sides.
Yeah.
Breathe in through your nose. Breathe out through your mouth. You're almost there. Oh,
Jeez.
through here.
Oh, just a bit of a muscle spasm.
Okay. Relax your arms totally.
Sorry.
Breathe out through your mouth. Not bad. Not bad. Let your tummy go. Out. Yeah. Bend your knees. Let your tummy out. Sit down. Breathe out. Go again. Perfect. Better. How do it feel?
I feel better.
Keep going, dude. How does it feel to stand up like that?
Feels better.
Seriously? Significant?
Yeah.
Brilliant.
By doing that breathing,
Yeah.
you're not holding everything in.
Exactly it. His cup. Pick it up the ground for me.
Oh, which way?
Where do you think I want you to pick it up?
With my hands?
Yeah. But if you're going to pick it up normally, how would you pick it up?
Go like this.
Yeah. And what did you do?
Didn't bend my knees.
Didn't bend your knees. You braced your back and you held your breath. So let's do it differently. So now this time, bend your knees, let your tummy go, fully relax your back and bend it and breathe normal. Better. Better. Pretty bloody good. Pretty fast. Starting to think they've paid you as an actor now, but this is the way to go for sure.
Go back for me.
Definitely not. We want to get you on the path to recovery with this. You lunge forward towards me.
All right, stop it there, Tim.
One leg.
This.
Yeah, bend both knees.
You can stop it, Tim.
Step back. Bring that foot back.
Stop.
Sorry. We might do more of that next
Didn't
time.
know whether it was real Kieran or
That's all right. the pretend Kieran.
Yeah.
The AI Kieran. Yeah.
Hmm.
All right. What do you guys think of that?
To be honest, I'm pretty annoyed for him. Hey, imagine 15 years of pain and fentanyl and tramadol and that sort of stuff, and you're just like, hey, just breathe and bend your knees and it's pain free. Damn, poor dude.
What do you reckon? It's wild, eh? Yeah. So that was like what I showed you guys last time, what I showed you today. When I'm assessing someone with back, that's the stuff that's going through my head. So obviously you can like he's a very good example, and exactly as you said, Jez, like why are we putting these people on opioids? Why are we sending them for lumbar fusion? Why are they having discectomies when a lot of their pain is driven through how they're moving? So his was like a pretty dramatic one where it's like he left at the end of the session, he was like in tears because it's when you see it now, you kind of can't unsee it. Like you'll see it all the time now. But that's why when I'm so all that stuff I did in the subjective leads me then to the physical. And so yeah, I would say that this motor control subclassification for back pain is some of the fastest ways. Obviously, I love manual therapy, and I still use core, but I don't want to give patients core and Pilates if they need like relaxation. So, what are the takeaways from what are the takeaways from that? Do you reckon in that case?
important to assess what they look like in the position, like at the end of the subjective, look
Yeah.
like no control, but he clearly wasn't that.
do you like how I was asking him questions when he was like going to move? I just kept asking him what he thought of it. So you basically, it's like a reflective, like you get him to you try to get him to answer the questions. So
Yeah. Well, you very nearly tricked him in the subjective when you said, like, how long do you think it's going to take to get better? Like, he really sort of, you can see the gears turning a little bit, and then you just regress to that, oh, well, the surgeon said never, so maybe not. But, like, you almost had him.
yeah. Yeah.
How much?
Um,
How much do you think you spiel at the end of the subjective about the treatment that you were going to do, and the fact you'll prove it today, and you've already discussed some of the evidence of its effectiveness, makes it effective?
I think part of it is like a self-fulfilling prophecy, right? Like you kind of, I think honestly, as you get more experienced and trained, you almost like set the patients up for healing. Like like there's quite a few studies that show that basically the confidence of the therapist determines the patient's outcome. So if you see me with patients, like if I think I can help them, I'll use quite positive affirmation and like you know, like if like with him, I'll like, can you see that that's better? Like, doesn't that feel better? Like you sort of like, some people would say it's leading him, but it's probably all a part of building his expectation because he's been given the complete opposite. So I think it's a part of it. Yeah.
So what was your management plan for him?
What would you guys do?
Well, I mean, initially just lots of recs of that.
Yeah. When would you how long do you reckon it's going to take to get him to change those habits?
I don't know, it might not be too long if he's reporting that it's such like a significant improvement. Like if he
Yeah.
goes home and breathes it,
Yeah.
it could be pretty good.
It's typically at least 3 months. Yeah. So I would suggest that you see these patients like once a week for 6 weeks, maybe, then start to space it out. Like but then you just got to make the exercises. Like as we progress through the video, I start like giving him lunging and like, he caught it straight away, whereas a lot of patients don't catch it straight away.
Yeah.
Yeah. We probably need to do at least one more of these sessions on lumbar control because there's quite a lot there.
Yeah.
But that's probably an example of how you can like turn cases around. Like there's a lot of these second opinions we do, and I'm not convinced these patients are cooked. I think a lot of them you can actually flip them away from, get them off opioids and yeah. Was that helpful seeing that?
Yeah.
Thank you.
No worries. All right. Cool.
Thank you.
All right, thank you.
Thank you
No
so
worries,
much.
guys. I'll see you next time.
See you next time.
Bye.
All right. Cheers, guys.